Over the last 3 to 5 years, three major trends that have emerged in healthcare are consolidation, new competition coming into the market from different types of providers, and then also continued development of new delivery models and new delivery approaches. So one of the biggest challenges that we're seeing clients continue to face is narrowing margins. So the impact to a client of a change in a regulation sometimes on the surface can appear not to be that significant. But once the full implementation's done, you begin to see what the full impact is to the margin of that provider. We typically can go in and start looking at where are you not leveraging your resources in order to be able to offset what could potentially be a challenge on narrowing margins. The other issue that's happening from a financial perspective that I think is driving a lot of the consolidation is access to capital. All right, there's a significant demand for capital in order to be able to implement some of these new models. So small providers more and more are having to look to partner or build new alliances in order to be able to access the capital markets. One of the trends that we're seeing continue to develop is new types of competition entering the market. CVS and Aetna announced a significant deal during the last year. That really brings a provider, which a lot of people don't see CVS as, into consolidation with an insurer. All right, so we think that could have some pretty significant changes in terms of the dynamics of various markets that CVS and Aetna have a significant presence in. In addition, there was an announcement made by JP Morgan, Berkshire Hathaway, and Amazon of forming a partnership to look at how they provide care to their employees. If you're in any market where you've got one of those competitors entering the market, it could potentially put a lot of competition into the market that you need to respond to and could have an impact over the long term on your delivery structure. I think from a delivery model perspective, it's something that we continue to pay close attention to. One of the biggest, I think, challenges that a lot of healthcare providers are facing now is how do you determine and demonstrate that you're delivering value-based care. All right, so there's a lot of demand now for data analytics, for evidence-based medicine that shows that I'm actually delivering quality care. I think one of the things that it's important to understand about McBee is we've evolved considerably over the last 10 to 15 years as the healthcare delivery model has changed. McBee has played a very active role in many of the mergers and deals that have been announced over the last year. So there were 8 deals in excess of $1 billion. McBee had an active role in 6 of the 8 deals and mergers. So we have a history of being able to help clients as the delivery model evolves with our existing services, and then looking at what are the other things we can bring to the market to help clients continue to prosper and grow in these kind of conditions. You know, the next 10 years in healthcare is going to be very interesting. We're excited about it. We see it as a challenge, and I believe we're well positioned to help our clients grow and prosper in that period.